Hello, welcome to the Equity Exchange. Thanks for joining us today. While we're waiting to get started, please check out the new features of the On24 platform, and we'll begin promptly at 1 p.m. Thank you all for joining us today. On24 may be new to some of you all, so there's some features we want to make sure we bring to your attention. The attendee chat is available throughout this entire session. You can use it to put your questions and comments with other attendees. We also have a Q&A box where you can leave us questions as well. Our resource hub has some interesting links that we'd love for you all to check out, and you'll be able to access a certificate of attendance at the end of this event. So click around through On24, you're able to resize your windows and customize your experience and really ease into the day with us. So it's 1 p.m. We'll get started now. Thank you all for joining us today. Just to introduce myself, I'm Dominique Davis, and welcome to the Equity Exchange. This is a new-ish virtual event from the National Institute for Children's Health Quality. This is our third event now. At NICHQ, we work on improving systems of care, maternal and child health, with a commitment to equity in all its forms, with regard to race, color, ethnicity, nationality, gender identity and expression, sexual orientation, age, ability, and religion. Equity is one of NICHQ's core values, and in 2022, we launched our Department of Health Equity Innovation with the goal of accelerating strategies that address systemic health inequities, which we know disproportionately affect BIPOC children and their families. So the Equity Exchange is a re-envisioning of a webinar experience, and our time today is structured so that you can contribute as well. We'll begin with some shared learning, followed by a focused discussion with Dr. Stacy Scott, our Vice President of the Department of Health Equity Innovation at NICHQ, and you'll be able to ask questions and share comments with other attendees. Towards the end of the hour, you can join the Department of Health Equity Innovation team and our guest speakers in a virtual reception room where you can freely speak and share your thoughts and questions to continue the conversation. So if this is your first time joining us, welcome again. And if you've attended a past Equity Exchange, welcome back. Through the course of this series, we explore emerging equity frameworks and speak with leading health and equity experts about topics like reproductive justice, equity fatigue and weathering, institutional power dynamics, and what you can do to address these challenges in your work and at your organization. So we have an exciting hour planned full of rich discussion and information and resource sharing. Next, we'll play a short video and then we'll follow it up with our panel discussion. So stick with us and we'll get started now.
July is National Minority Health Awareness Month. The U.S. Department of Health and Human Services, the Office of Minority Health, is focusing on improving mental health outcomes for racial and ethnic minority and American Indian and Alaska Native communities through its 2024 theme. Be the source for better health, improving health outcomes through our cultures, communities, and connections. This theme calls on each of us to better understand how the unique environments, cultures, histories, and circumstances known as social determinants of health impact the mental health of Black, Indigenous, and other historically minoritized populations. Research continues to emerge highlighting racism and discrimination as key drivers of negative health outcomes impacting historically marginalized communities. Join NICHQ as we explore the weathering hypothesis, equity and ally fatigue, and the challenges of both navigating racist and discriminatory systems and working to dismantle them. Arlene Geronimus wrote about the weathering hypothesis in the early 1990s to explain health disparities in newborn babies and birth mothers due to years of social, economic, and political oppression. The hypothesis suggests that the combined impact of racism, economic hardship, and resulting stress through a Black woman's life deteriorates her health, increasing her susceptibility to adverse obstetric outcomes as she ages. These initial observations in sociology have been backed by biological evidence that shows the long-term impact of racial stress. Black women, on average, show biological signs of being 7.5 years older than white women of the same age. Exposure to weathering can also lead to socioeconomic disadvantages for marginalized communities, where they often face economic challenges, unsafe living conditions, and limited access to health care, further contributing to chronic stress. Chronic stress due to exposure to weathering can be triggered by racism and discrimination, and has been linked to various health problems including hypertension, cardiovascular disease, and mental health issues. In addition, weathering may have physiological effects such as wear and tear on the body's systems due to repeated exposure to stress, and chronic inflammation and impairment of the immune system, leading to increased susceptibility to infections and autoimmune and chronic disease. It is well documented that individuals from marginalized communities, including people of color, experience worse health outcomes compared to white individuals. This is attributed to various stressors such as prejudice, social alienation, institutional bias, political oppression, economic exclusion, and racism, all factors that contribute to premature death. Some providers, hospitals, and communities, especially in the maternal and child health space, have acknowledged that weathering contributes to adverse perinatal outcomes. These organizations have been working on addressing these issues over the past few years, but the path to a solution is unclear. Unfortunately, the burden of this work often falls on staff of color who are provided with limited resources, which can lead to both equity and ally fatigue. The term equity fatigue refers to the exhaustion and frustration experienced by individuals, organizations, or communities engaged in long-term efforts to promote equity, diversity, and inclusion. Racial equity fatigue and ally fatigue often refer to people who are tired of talking about racial equity. However, racial equity fatigue is more than just being tired of talking about equity, especially for those involved in equity work. The physical and mental exhaustion experienced by people of color can be relentless. As stated by the leaders of Color Fellows, recognizing that many of our white colleagues may be able to walk away if they get tired of these conversations, we, people of color, can't take a break. We can't walk away. We will always be of color. It is understandable that many allies face feelings of exhaustion in their day-to-day life because of what they learn from oppressed people. They can feel overwhelmed with guilt and sadness upon discovering the mistreatment of people due to their skin color or nationality, gender identity or sexual orientation, or disability status. Intersectionality reminds us that people who hold a multitude of minoritized identities may experience mistreatment in compounding ways. Collectively, feeling unsupported by leadership and others by a lack of resources and tools of differing priorities that do not promote equity work can lead to disappointment and the belief that nothing seems to be changing for the better. These types of fatigues can arise from various factors and manifest themselves in different ways, such as persistent resistance to change, slow progress in change, and emotional and psychological toll on those invested in equity. Persons with equity fatigue may experience and decreased motivation to do equity work, cynicism and disillusionment toward the possibility of achieving equity, reduced engagement and lower participation in equity-related activities and initiatives, emotional exhaustion and feeling emotionally drained and unable to continue advocating effectively, and ultimately withdrawing, which includes stepping back from leadership roles or active participation in equity efforts. Equity fatigue is having a noticeable impact on maternal and child health, particularly among marginalized communities. This impact is reflected in several ways, such as healthcare access, quality of care, perinatal health outcomes, political fallout, reduced funding, just to name a few. Chronic stress and the cumulative burden of inequities can negatively impact the health of mothers, birthing people, and their children, contributing to a higher rates of preterm births, low birth weight, and infant mortality. Persistent inequities in healthcare can lead to fatigue among healthcare providers, community advocates, resulting in reduced efforts to reach underserved populations. Racial equity and ally fatigue contribute to emotional and physical exhaustion, high turnover rates, reduced advocacy, reduced funding, and support for equity work. What must we do to address and prevent racial equity and ally fatigue? As a public health professional and care provider, it's important to support Black, Indigenous, and people of color in achieving their optimal mental health by ensuring equal access to all health services and reimagine systems of care that are inclusive and center the voices of people from historical marginalized communities. Stay connected to NICHQ for resources, tools for change, and learning experience like the Equity Exchange. Welcome, everyone. Thank you for being with us today. Thank you for listening to that message. And really want to welcome everyone into the space. However, as you arrive, and hope you can present and engage during the time together. So we would love to hear from you as we begin our dialogue. I hope you've come ready to be able to share with your challenges as well as some of your successes. Before we get started, though, and to make the most out of the day, I want to kind of talk a little bit about just what we refer to as an opportunity to have community engagement. Feel free to share additional ideas in the chat, but at a minimum, we ask you that you listen with intention to learn, that you embrace mistakes and own their impact, that you make room for others to speak their truth as well as you speak your truth, and challenge the idea that not the person itself. So again, thank you. We really look forward to having you join with us today. So as we get started, I am moving my slides over. Just a moment. Okay, got them. I want to start out by introducing our panel today. First, I'd like to introduce Kay. Oh my God, my mind just went blank. I've been practicing the name, Kezia, I'm so sorry, Ofosu Atta. And if I said that incorrectly, you can definitely correct me. So today, she's the owner of the ICAD Consulting LLC, an independent policy analysis, grant writing, and government affairs agency. She has an extensive background in education, health policy, and legislation, particularly in maternal and child health. Our next person that we would like to introduce is a close ally of mine, and this is Rebecca Russell. She's Vice President of Applied Research and Evaluation. Becky is a longtime maternal and child health researcher, and with an extensive collecting, evaluation, and expertise in collecting, evaluating, and presenting data to drive change and help eliminate health disparities. Our third panel is another ally of mine, which is Jackie and Jacqueline. And Jackie is a project director at NICHQ, who has worked extensively with the state hospital teams to improve health equity, including through enhanced data collection, reporting, and please, you can read the bios below for more extensive. And again, I didn't say her own name, Jackie Kellican. Thank you so much. So with that, we are going to get started. And I'm going to present some questions to our panel members, and then definitely put all of your questions and everything into the box. I went too far, so sorry. So I want to begin with Kezia. And the question that I have for you, based on your background in health policy and legislation, particularly in MCH, so what's one strategy you recommend organizations implement to maintain momentum in equity initiatives while navigating environments that are becoming increasingly hostile to equity work, as we've seen through the rise of state anti-DEI legislation?
Thank you so much, Dr. Scott, and thank you, NICHQ, for having me on this amazing discussion. To answer your question, I have two responses. So the first is coalition building. I think coalition building is really necessary for organizations to implement and maintain momentum in equity initiatives whilst navigating these hostile environments that they come across. So through programs like the Equity Exchange through NICHQ and others, we can bring together individuals and organizations and groups with similar policy interests to create a strong movement-driven focus group dedicated to attaining the goals at hand. So in these coalitions, you can have a shared strategic plan with specified outcomes available and actionable steps outlined where each member of the coalition can leverage their strengths to help promote and attain the goal at hand. I'm Ghanaian, and there's this quote that we always say in my Akan dialect that goes by Tikro Nko Ejina, and it means that two heads are better than one. And coalition building is a way in which we can get rid of the silos that happens in the advocacy field so that we can be able to not go at this equity work alone, but we can go together. I believe that you cannot go at it alone, as I've said, but you need a group to build momentum. Otherwise, we become tired and weary. The second answer to that, which kind of deals with coming in contact with the roadblocks and the hostility that we face in the equity work, is that we can look at the solutions to these equity challenges from the bottom up instead of the top down. As a person in policy, we tend to look at things from the top, but the top-down perspective in equity work makes it overwhelming because we seek solutions from predominantly in the legislative spaces, from predominantly Republican policymakers that usually do not have the equity mindset at the forefront of their minds. And they usually think one-time investments are the solution to systemic equity or inequity issues that are plaguing historically disenfranchised demographics in our community. So with when these solutions to these systemic issues, they require continuous, specified, targeted and digging work to arrive at these goals, it makes individuals that work in these equity spaces burn out. And in addition to burning out, if we go to legislators that are only here that they would like to fund things at a one-time investment pace when something is very systemic and you cannot just throw one-time funds into it, it makes it very tiring. So I would recommend that we practice bringing frontline workers to these legislative levels and into these coalition building spaces. So in your coalitions that you build, that you have people who are frontline workers, so medical providers, doctors, nurses, community health workers, people who have that on-field experience to also bring solutions that will help us look at it systemically from the bottom up rather than the top down perspective. Lastly, the practice of bringing these frontline equity workers to legislative levels should be continued. I know that a lot of organizations do it, but I think I would recommend it to be continued, and so that they can be able to be implemented in these troubleshooting processes to better help us arrive at our viable solutions. Sometimes frontline workers solutions bring ideas that might not seem, because from the policy level, some ideas and some solution might seem viable. But sometimes when you bring a lot of the times when you bring frontline workers to these conversations, they might arrive at solutions that people in the policy scope might not think about or might not arrive at easily. So it's very important to build coalition, not only to build coalition, but to also involve people who have the day-to-day experiences to be able to alleviate and ease the stress and the burnout for policy workers and advocates in this space. And also sometimes when legislators come in contact with people who live the life and work on it day to day, they are able to listen to their stories better and be able to arrive at solutions, and are more open to listening to a nurse, a doula, a community health worker, rather than a person like me who's just worked in the policy space, who's just coming, knowing how the system works, but they would rather hear from somebody who lives it day to day. So implementing that, one, decreases burnout and also prevents that hostility, because a legislator cannot be hostile to a person that works in that environment who could be their constituent as well. So thank you so much, and those are my answers to that question.
Thank you. I see a wonderful comment in the chat box, and we won't talk about it, but just want you to look at that, with the fact that we're seeing such resistance about using such words, social determinants of health and equity and whatever else, thinking about what are some of the strategies that we can use to be able to at least get that information out, and not get shut down. And I know you have experiences, I do too, especially in talking to legislators in regards to that. So just think about that as we move to Becky. Becky, I have a question for you. As a researcher, how do you think organizations can incorporate data to help improve engagement in equity initiatives and minimize the impacts of equity and ally fatigue?
Thank you, Dr. Scott, and welcome everyone. Good morning, good afternoon, wherever you're coming from. And I really think this is an important question. Evaluation and data collection is always an important consideration for any organization that's doing equity-focused work. In public health, we think a lot about how we demonstrate the impact of our work externally, but it's also valuable to think about what you're trying to achieve internally and how you can measure your progress. It's how we hold ourselves accountable to this work. Data is so powerful in that aspect. But we also need to recognize that surveys, data collection, it's just one more thing that we're asking our staff to do that can contribute to that overall fatigue. And so it's really important to think carefully through what you're collecting and why. The first thing I would say that is that as an organization, don't try to do and measure and collect everything at once. Our tendency is to want to change everything and as quickly as possible. And I appreciate, and I know, and I recognize there's quite a bit of privilege in me being able to say that. But I think it's important that we listen to our staff, that you listen to your staff, especially people of color, and you give them a space to provide that honest feedback, whether that's through surveys, whether it's through an anonymous feedback opportunity, whether it's affinity groups, some safe space for your staff where they can provide you with their experiences, talk about that, provide that feedback, and then work as a team to prioritize that feedback and figure out actionable steps based on that data. The second piece that I think is important is that where possible, it's important to understand both the perspective of staff and their experiences. And I think that this is something that we often overlook, but the system justification theory tells us that people really want to assume the best of the systems in which they work, in which they live. And so just asking them what they think or what they are observing isn't the whole picture. So if you have an opportunity to ask about experiences with equity and then compare that data to the perspectives, I think it can be incredibly enlightening in terms of where your organization's at and where you want to move to. And lastly, with any research or evaluation, don't just collect data for the sake of collecting data. Ask targeted, specific questions. And most importantly, share that data back in a timely manner. Recognize that you're asking folks to take time out of their day to provide you with information. Provide it back to them, share it back with them. Let the organization see the results and show them the impact of their efforts. Give them credit, let them share in the joy of the progress, give them opportunity to contribute to both the interpretation of that data and to identify potential solutions, and use this data to hold yourselves, hold your staff, hold your leadership and everyone at the organization accountable for that improvement. Data can really help with that, and it gives everyone a voice in the process. And then lastly, just as an ally, I think it's important that we step in and step up, that we can't expect people of color to be the ones responsible for fixing what hundreds of years of racism and oppression have built. And so it is important for us to take on that burden and to share that burden and to be an ally. But we need to listen as allies. We need to demonstrate that we ourselves are trustworthy as allies. And we need to hold ourselves accountable to that change that we want to see. And yes, that can be tiring, but at the end of the day, we do have the privilege of shutting down our computers and stepping away, and we need to not take that for granted.
Can hear me? Could you hear me? I am so sorry. So Jackie, as we move, I want to ask you the question. Through your work with hospital teams, can you share an example of how you've seen equity and ally fatigue impact providers and other healthcare workers, and how your team has navigated it?
Sure. Thanks for the question, and I'm so excited to be a part of this conversation. So at NICHQ, we do have the opportunity to work with state perinatal quality collaboratives. And for one particular state that we worked with recently on a multi-year project, we were fortunate to have equity be the center of this perinatal quality collaborative. And we had several dozen hospital teams be part of a collaborative where the goal was to improve both the experience and outcome for Black birthing people. And one of the ways I feel that in a positive way that we provided support to work on equity was, as Kezia pointed out, kind of at a high level, there was support. There was a space where hospital teams could go that we provided, where we talked about these issues, where we talked about and tried to create a supportive environment for education. Hospital teams assembled themselves, and they were multidisciplinary, and they were also very diverse in some cases. And we talked about very early on the shared responsibility of education, of support, of allyship. And as Becky pointed out in this project, we tried to center on the voices of Black birthing people in particular, and tried to use the data in a very specific way to let the teams see what the impact of their care on Black birthing people, and try to create small changes, as Kezia pointed out, to create improvement. And I think that a positive thing about working in that way was, by working in a small way, it allowed teams to sometimes see a positive result, and one that they could, really be supportive of each other to achieve. They could get feedback on it immediately, and that was really encouraging for the teams, I think. So working in a small way, again, as Kezia mentioned, was really useful. What was very challenging was that in the case of some facilities, there was not a lot of support from leadership to do this. There was a very small team. This wasn't work that was being compensated for, aside from, the freedom to work in the collaborative. So the work was overwhelming for some people. There was a lot of staff turnover during this project, not necessarily because of the project, really more because of COVID, but there was and is a lot of staff turnover, often in hospitals. And so I think that for this project, it allowed hospital teams to work on small changes, try and put them in the workflow, try and achieve slow changes over time. But leadership and buy-in from leadership and support from leadership was really critical in order to work to combat really equity fatigue and also ally fatigue.
Thank you. So I'm looking at the chat. I love it. I've seen different things about target universalism, things of that nature. So what I'd like to do though is to kind of go back a little bit, because we're looking at some of the solutions or whatever, but looking at this being Mental Health Month and the impact that many of us experience in doing this work. I just want to start with Jackie a little bit, because I know the project you're referring to. And one of the things that we saw a lot of was Black tax, and people define that different ways. But when you champion equity, usually within an organization, usually you have people of color who are the ones on the front line doing this work and trying to champion equity with little to no resources. They're really volunteering on top of the things that they already do. And I'm just wondering, Jackie, could you just speak to that a little bit? Did you see that in your project?
We definitely saw that in our project. The state that we were working with is a large state. It's very diverse, but there were a lot of the project leaders for this project tended to be from nursing staff. Many were of color. Many were, whether they were of color or white, they were working sometimes without a lot of support. And that was a lot. And they did feel tired from that. They did feel discouraged from that. There were some teams when they went to ask for support, an answer was, well, we can get a teen intern to help you. And that is not really an answer. So we did see this really throughout the project, definitely. And, we would hear about it on our coaching calls. People would share.
Okay. I want to go back to Kezia. Someone put in the box about target universalism. And, I think in using that particular term, especially in talking to legislators, are pretty, it's a way to go. And I can speak from my experience in talking to legislators of saying that, when you, and many might not know what target universalism is, and this is a real high level definition. So, I think somebody put the link in the chat box, so don't go by. But basically what I say is that we, especially around infant mortality, for example, one of the conversations I had with a legislator, it was saying that we are concerned about all babies and their survival. However, we know that Black babies have a tendency to be impacted more by infant mortality. And because of that fact, that if we work to improve the outcomes of birth for Black infants, it will in turn impact all infants in improving services. And so I just want to know from you kids, is that another way of approaching having that conversation?
Definitely, yes. A lot of these legislative committees are chaired by a majority Republican leaning representatives who would like us to approach the conversation about mothers and babies in a broad spectrum. And sometimes it feels like we have to be able to have the ear, meaning we have to be able to generalize our terms to cover everybody, so that at least some Black mothers and some Black babies can be covered. And there's a bill that recently passed the Ohio House Bill 195 is for Black Maternal Mental Health Week. And it passed in the House last December, and it took so long just to be able to pass in the House. And after it passed in the House, it moved to the Senate, but there has been nothing done about it because the title is Black Maternal Mental Health Week. So sometimes you see that pushback with bills that have the titles that are focused on solely Black or solely a specific demographic. And sometimes in even testifying, I've learned throughout the years that you have to approach it in a generalized mindset that all mothers, all babies, all birthing people, so that in order for at least the individuals in the demographics who are predominantly affected to get a little bit of attention. But I think one key factor that I make sure to include in my testimonies and my conversations with legislators is that even if I'm going to be general, I'm going to include the facts and the statistics that point out the disparities. So it's like my first couple of sentences to you are generalized, but in that middle sandwich in there, I'm hitting you with the facts that, hey, these are the disparities that we see, and this is what we should do about it.
Thank you. I love that, because I know there's probably people on the call going, we shouldn't sugarcoat it. We should take it for what it is. We should use the word racism. We should use social determinant of health. We should use equity. And I 100% agree. Unfortunately, just for what you mentioned, these are some of the things that just automatically shut people down. Mm-hmm. And so I think that it's very difficult for us, especially for people who are champion equity, to walk that fine line to say, am I selling out my beliefs and things of that nature because I'm taking this approach? Or by taking this approach, at least I know I'm able to help others. So that's something I constantly wrestle with. And I don't know if others on the call do, but that's great to be able to hear that. So finally, I'm coming to Becky. I'm ready for you, Becky. So
I know, I'm ready. Here we go.
You ready? You ready? You mentioned social justification theory. And this is so key in collecting data. We are so wedded to now the lived experience of others. We do all of these surveys, we collect this data. But one thing that I've learned in some of the projects that I've been on, it's not so much what the data tells you, but what is the data not telling you? And so when you ask people about their perception of care, a lot of times we see Black women who would indicate that their perception was pretty good, that they got good care. But we looked at what the results of their survival rates and all of these kind of things that were really bad. And so you begin to say, well, what is going on here? Why are not people saying that? And so there's a few reasons why when we look at that system justification of that, number one, people might not even have an idea what good service is. So when I ask you, is your service good? You really don't know. Is that one of the cases, Becky?
Yes, I mean that's exactly right, and we have seen that in some of our data where, data collected at a hospital on patient experience or looking at other outcome measures around our initiatives. First thing that's really important is to be able to disaggregate your data by race and ethnicity. Whenever possible, so that you can look at it that way. I think that's incredibly important. But the piece you said, Stacey, and I hear it in my head, maybe because you've said it so many times, is what is the data not telling us? And you really do need to take a look at it and say, where is this data that we're collecting? How does it compare to the health outcomes? How does it compare to the ultimate experience and health of the people that you're trying to serve? And so I think that that's incredibly important. And in the work that we've done around assessing organizations along an equity systems continuum or maternal and child health systems continuum, we've seen that when asked what type of organization they think they work for, staff may respond that they think their organization is very allied designed or allied centered or equity empowered. But when you ask them about their specific experiences and you get them to share their experiences with you, you see that they have those experiences of racism and discrimination that are happening. So it's important to capture the stories on both sides, right? You can collect all the data you want. I am a quantitative researcher by trade, if you will. But in recent years, especially more and more as we do equity-focused work, that qualitative data, that capturing of the stories and looking at, in folks' own words, their experiences, and helping to use that to interpret your quantitative data, it's invaluable. And it really does help us get at and try to understand what's missing from that data. What's that data not telling us?
And I guess the question is, since the topic today is really about equity fatigue, ally fatigue, looking at this particular data, how can it be shared with leadership? Or can it be shared with leadership in regards to telling a person's experience, looking at the perception and equity? You know, and I think that that's another big piece that we see, the repercussions of speaking your truth. At that, you know, you could really run into some of these type of things that, you know, could cause you to lose your job, could cause you just all kind of things that we are seeing, or the mere fact that you just burned out. And, you know, in the words of Fannie Lou Hamer, I'm just sick and tired of being sick and tired. And I think I'd like to ask Kezia a little bit to weigh in on that, some of the experiences and stuff in regards to that. Kezia, want to share? Mm-hmm.
Definitely. I second that quote. I think you find yourself in this space being sick and tired of being sick and tired. But for me, what keeps me going is that if there is a bill regarding equity-centered bill, that I give it my all. I give it my all, knowing that in Ohio, the legislature is majority Republican. So I give it my all, give it the push that I can. And if it gets there, it does. But if it doesn't, we don't give up. That the coalition building that I talked about earlier, we're continuing to feed our coalition, and that our coalition, we can go back and regroup and come back to continue to do better and find ways in which we can attain our goal, whether it's on the bigger level or at the basic level, on the frontline level.
And so I'd love to encourage anybody from the audience, if they'd like to put some questions in or comments, continue to do that in the chat. I think I'd like to say to both Becky and Jackie, what are some of the things that you've experienced as far as ally fatigue? I'd love to be able to hear that. I know you've been on the front line with me these last few years working this work, but have you experienced ally fatigue? How has it impacted you? What could you share? Mm-hmm. Jackie, you want to begin? Mm-hmm.
Sure, yeah, I would love to. Thanks for the question. And I think that as a white person, I think, and I've been privileged to think, like, wow, once people see a problem, they're going to do everything they can to fix it. And, you know, working in a project for a couple of years where, you know, part of it is about increasing awareness around structural racism in a hospital setting. You know, seeing after a couple of years that the big system is not turned, you know, and that the work has to continue every single day. And that it's very easy if equity, I think one of the things I really learned is that equity needs to be at the center of all projects, really, because if it isn't, it is brushed aside. And I think that that's a very hard realization. It's very difficult work. And the structure of conversations sometimes around projects will always put equity last. And so I feel like I definitely, you know, experienced disappointment and again and again with that. So That's my answer.
Yeah,
Becky?
I mean, I second what Jackie says, but you know, certainly I have experienced fatigue in lots of different ways. I do get, you know, you get tired. You look at the data as a data person, someone that loves data. It's not changing in the right direction. That, like, we're not seeing an improvement where we really need to, and we're not closing those gaps, and we're not accelerating movement towards equity. And when we talk about it all the time. So I get tired. You get frustrated. I get very mad at the system when we don't see the improvements that we want to be seeing. And so you do need to, you know, make sure that you're taking care of yourself and you're, you know, practicing self-care, but also recognizing your privilege in being able to do that. It does help me a lot to have trusted individuals like yourself, Dr. Scott, that I can talk to. And sometimes it's a couple days a week where we have to get on a call together and talk and
Exactly.
vent a little bit, but then also think about some solutions. And so, you know, it just keeps you grounded in the work and makes you understand when you hear the stories, when you hear the lived experience of folks, it keeps you focused, it keeps you passionate about the work.
Thank you. I see Dominique's come on, so I guess my time is winding down, but I just have two quick things. I think there was one that was really in response to Kezia from Diane on how can we expect to have a real equity and disparity shifts if we still cannot use the word Black. This is still the box policies that try to contain folks of African origin and ancestry. And I think we kind of spoke about that on how we talk about target universalism and things of that. But I don't know if anything you wanted to add to that, Kezia.
I think just a little bit I would like to add about that. I think even though we face these setbacks in these policies with the titles, different titles, I think we should keep going because people like Becky can be able to have data tracking system where they can see and show the world that these bills are not getting the attention or the movement that is necessary. And at the end of the day, we can be able to call out these people that we voted for to represent us that, hey, this is the bias that we've seen in the legislative system and that they should address it. So I definitely agree with you on that. And I think the more we put these type of bills out there, there will be a pattern to be drawn. And once there's a pattern, we will have a story to say.
Okay. And one last one, Crystal Hawkins, don't worry, we are working on that right now. She asked a question, why is there no studies on whether the Black and brown healthcare providers working in the equity issues and to provide services? So stay tuned. We are really in part of that process at the Department of Health Equity within NICHQ. We're going to have some conceptual clarity convenes in the next couple of months that we're going to invite people who are working in this field to talk about their experience around weathering and people who are providing that service. So thank you so much for that. Stay tuned as we continue to go forth. I'm going to hand it back over to Dominique, and thank you all so much for engaging. I know we could have went on and got much deeper, but we're just scratching the surface, and we hope to be back and definitely continue this dialogue. We have to keep our radical imaginations going and understand that change is going to happen. We are looking to a positive future. Thank you.
Thank you, Stacey, and thank you all for those incredible questions and comments in the panel or in the chat during the panel. We have an evaluation it's short. We just want you to take it before you head over to our reception room. So your responses will help us improve the equity exchange. And if you could select the survey icon from the menu at the bottom of your screen, you'll be able to take this brief survey with us before you head over to our reception room. And then we also wanted to just thank you for participating today and thank Dr. Scott. Thank Kezia, Becky, and Jackie for joining us in such a riveting discussion and leading us with such thoughtful responses. This was brought to you today by the National Institute for Children's Health Quality, and you can stay connected with NICHQ via email, social media, and through our 2 podcasts, Before Birth and Beyond, and Catalyst Conversations in MCH, where we focus on equity-related topics. So hope to see you all in the reception room to continue some of this discussion until 2 p.m. And the link to that will be in your resource center and also in the chat. So we will see you there, and be well. Thank you for joining us today.